Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. ERCP and the MRCP. So for the biliary, in case of biliary, there is ERCP, the ERCP and the MRCP, as well as the T-tube and the percutaneous transhepatic cholangiogram. So when the ultrasound is not effective, so in case if it is not effective, a CT scan is opted. So first let's look all about the ERCP. So here in ERCP it is nothing but it is endoscopic. There is a contrast X-ray is done and this is under the fluoroscopy. Then comes there is a radiation exposure. It is invasive, that is it is a gold standard. The advantage is there is a therapeutic as well as a diagnostic. There is a luminal pathology and contrast is there is a iodinated contrast is seen. Now looking at the MRCP, it is the MRI and it has no radiation exposure. It is a non-invasive and looking at the advantage, it is diagnostic only and it evaluates the rest of the structures. Now on contrast, there is no need for contrast, no need, and it is heavily a T2 weighted image. To learn and grow daily like this, please do subscribe.